Welcome to the deep dive. Navigating health claims online these days, it's a real challenge. So much information, it's hard to know what's solid.
It really is. Misleading advice is everywhere, especially with medical stuff.
Exactly. So today we're doing a deep dive into something called lipoprotein, or LPA. Maybe not super well known, but actually a critical risk factor for heart disease.
Hmm.
Our plan, we want to unpack what Professor Lin's research shows, maybe challenge some common myths, and help you, our listener, build those critical thinking muscles for health info.
Absolutely. It's all about synthesis, looking at different pieces of information, questioning assumptions. We'll get into what LPA actually is, why it matters, and importantly, how the science sometimes goes against popular belief.
Okay, let's jump right in then. Critical thinking hats on. We heard this story right. A doctor, pretty confident, taking statins specifically for high LPA, like it was the direct fix.
Right.
But does that really hold up? This is where it gets
Yeah.
interesting.
Yeah, it really does. And that's a perfect example where Professor Lin's work is super relevant. Because that belief, it's widespread, but the evidence, well, it points elsewhere.
Oh,
Several studies, recent ones too, actually show that some common statins, like pravastatin and torvastatin, they can increase LPA level.
increase, not decrease.
Increase. We're talking potentially 11, maybe up to 24% higher. And the really crucial part, this increase just might be linked to a higher risk of, major cardiovascular events.
Wow. Okay, that's unexpected.
It is. It shows that just because a drug is great for one thing, like lowering LDL, the bad cholesterol, it doesn't automatically fix everything related. You can't just assume.
Right, you need to look at the whole picture. So that physician's next move, switching to inclisiran, was that the answer for the LPA?
Well, inclisiran is excellent for LDL, really brings it down.
Okay.
But for LPE, the reduction it causes is generally seen as, well, not significant enough to really tackle the LPA-specific risk head-on. That's what the sources suggest.
So not the magic bullet for LPA either.
Not really. The good news, though, is that there are new drugs in development, very specifically targeted at lowering LPA. That's where the focus is now for direct LPA treatment breakthroughs.
Okay, so medication isn't always straightforward here. This brings up another common idea. LPA is mostly genetic, right? So does that mean lifestyle stuff, diet, exercise is basically useless for it?
Ah, that's such a key point. And Professor Lin makes a really vital distinction here.
Okay.
It's true, lifestyle changes, they usually have a pretty minimal direct effect on your LPA number. Your genes play a huge role there.
Right, that's what I thought.
But, and this is the critical part,
Yeah.
those same lifestyle changes are absolutely essential for controlling all the other things you can change. Your blood pressure, your weight, getting that LDL cholesterol down.
Ah, I see. So even if it doesn't lower the LPA number itself?
Exactly. Managing those other factors is fundamental for your overall heart health, no matter what your LPA level is. It's about controlling what you can control. Don't give up on lifestyle just because of the genetics of LPA.
That makes a lot of sense. It's about the whole risk profile. Okay, so putting this all together, the really practical question is, who should actually get tested for LPA? For everyone.
Good question. The guidance, based on recent sources, is leaning towards measuring it at least once in pretty much all adults.
Oh, really? Once for everyone.
Yeah, the idea is to identify people who might have this hidden risk, but it's especially important for certain groups.
Like who?
Okay, so definitely consider it for adolescents who've had an ischemic stroke, a clot-based stroke, or signs of artery disease really early on.
Right.
Also, anyone with a family history, either of high LPA itself or just early heart disease running in the family.
Makes sense.
And people who keep having cardiovascular events, even though their cholesterol seems well managed with drugs, and there's no other obvious reason why. And finally, patients diagnosed with familial hypercholesterolemia, that genetic condition causing super high cholesterol. Testing LPA is recommended for them too.
That's a really helpful breakdown. So we've covered quite a bit the surprising facts about statins, the limits of some other drugs for LPA, the importance of lifestyle. It really underscores Professor Lin's point about needing to think critically, doesn't it? Look beyond the headlines.
Absolutely. It's not just about hearing a piece of health news or advice.
Yeah.
It's about asking, okay, what's the evidence behind that? What are the nuances? What does it actually mean for me?
So connecting this back, it's about digging deeper than face value.
Precisely. And maybe that leads to a final thought for everyone listening. When you come across new health information, how often do you stop and question the assumptions baked into it? What steps do you actually take to check out the full scientific picture behind the claim? Something to think about.